Hello, my name is Erin O'Henley. I am a pelvic floor therapist and orthopedic physiotherapist at Synergy Sports Medicine. Today, I would like to answer some common questions about pelvic therapy and help prepare you with confidence and positive expectations for your first visit. Pelvic floor therapy is the assessment and treatment of the muscles, nerves, and fascia inside and around the pelvis, including the lower back, the lower abdomen, and the hips. The pelvic floor muscles sit like a hammock at the base of the pelvis, where they support the internal pelvic organs, but also can contribute to continence, sexual function, and core stability. Pelvic physiotherapy can be used to help patients of all genders recover from conditions such as pelvic pain, leakage or urgency of the bladder or bowels, constipation, loss of sexual function or painful sex, low back or hip pain, and diastasis recti. We are specialists in treating prolapse and pregnancy-related pain and work closely with your midwife, OB-GYN, or doula as part of your prenatal team to assist with birthing prep and also postnatal recovery. As physiotherapists, we have the privilege of being able to continue seeing our moms for a longer time after delivery as well. What many people may not know is that pelvic physiotherapy can also help our male clients prepare for and recover from prostate surgery and chronic non-bacterial prostatitis. We can also assist our patients to prepare for and recover from gender-affirming or gender transition surgery as well. The first session begins with a discussion of your symptoms and the history of your condition leading to this visit. We often discuss topics such as your birth story, previous experiences with your condition, previous treatments you may have had, and your goals in physiotherapy. We then discuss the pelvic anatomy and the areas that we will be assessing so that you can feel comfortable and oriented to this part of the body and to the exam itself. You will have many opportunities to ask questions, and we will only proceed with the exam if you feel comfortable with it that day. During the physical exam, we often first look at the low back and abdomen as they are closely coordinated with the pelvic floor in what we call the inner core system. Sometimes, if we have reason to believe that your pelvic floor symptoms are coming from these areas, we may proceed with external treatment only on the first day. Otherwise, we then proceed with the internal exam. We don't use any speculi or other equipment that you might be familiar with from previous medical appointments. We use only our hands and light touch, similar to how we might feel the muscles in the wrist or the shoulder. You are invited to ask questions at any time during this exam, as this can be many people's first time seeing their pelvic floor or practicing self-care of the pelvic floor. This is a great opportunity to orient yourself to this part of the body if that is one of your goals. The exam gives us information about the mobility, strength, and endurance of these tissues, both externally and internally in what we call the third layer of muscles or the pelvic bowl. We can also check to see how your pelvis is moving with your breathing and coach you on how to use these muscles as part of your core in day-to-day activities. We finish the first session by applying what we found to a treatment program. We can give you a diagnosis of your symptoms, discuss which exercises would be most helpful, and discuss the next steps of treatment moving forward. Each treatment program is unique and designed specifically for your situation. Surprisingly, some people do not need to strengthen their pelvic floor and may benefit more from lengthening these structures instead. You can think of this much like how we often try to relax the tension in our upper shoulders where many of us hold stress. There are several gentle manual therapy techniques that we can use to help encourage these muscles to relax and lengthen, and then self-care strategies and exercises you can do at home to keep them from tensioning up again. It is often very quick and easy to determine which path, strengthening or lengthening, would be best to start with, and the internal exam really helps us determine that with greater accuracy. I hope this has answered some of your questions. We look forward to meeting you, and please don't hesitate to contact us for further information at any time. Have a great day and all the best.